Hello everyone. So let us continue our discussion about epilepsy actually. So now in this video we are going to see about the diagnosis and then treatment actually. But before we go into that, in the last video I want to make it to not to be longer actually. There's two things I missed out. I didn't actually talk about them. About the type of, let us talk about them first here. About the type of actually generalized seizure. We also have myoclonic. Sorry to forgot to mention it there. We have myoclonic seizure, which is another type of generalized seizure, and also this present with actually a kind of short duration, short duration twitching of some muscle group actually, twitching of some muscles. So this is a myoclonic seizure, and this is what another type of what generalized seizure. And also we have the other thing I forgot to mention is post-ictal seizure. Post-ictal symptoms actually, sorry. When we say post-ictal symptoms actually are the symptoms that may occur or that may be seen after the seizure has already occurred actually. So when post means after, right? Ictal means the seizure, that's the pitting, right? So that's it. So the symptoms that may occur after the seizure has occurred is the patient can have a kind of confusion, and also mostly the patient can have a kind of paralysis of arm and legs actually, right? So this is called arm and leg, and also this is called what, third paralysis. And usually this third paralysis take actually within 2 days, then it will go away. That is lasts only 2 days actually. So that is it. So this is the thing I forgot to mention actually earlier. So now let us actually see the diagnosis. How we can diagnose? Since we say there is a kind of variety of things that may actually causes this epileptic seizure actually, so we have to make a kind of wide range of method of diagnosis. Most importantly, brain imaging actually, to see if we have what, for example, tumor or anything that may increase the intracranial pressure actually. And also we have to analyze actually the ABG, arterial blood gas, to see if we have maybe hypoxia actually, right? And also we have to look for to measure the level of serum electrolyte, because as we have already saw earlier in the last video, electrolyte imbalance can lead to this thing, and also can lead to this seizure, and what, and the glucose actually. So that is it. And then EEG has to be carried out actually. Also the diagnosis. Then treatment actually, for the treatment of epilepsy actually, the first drug to start with is a kind of drug called lorazepam actually. And then if the patient didn't stop the epilepsy, actually the seizure, epileptic seizure actually, then you have to add a kind of drug called phenytoin actually. So still, if the patient didn't respond, is also responsive actually, then you have to also add another drug called phenobarbital. Also, if still the patient didn't respond to the phenobarbital actually, then you have to add midazolam or propofol. So these are the drugs of choice actually that is used in epileptic patient actually. So that is it. And also specifically, if the patient have a kind of tonic-clonic seizure, specifically, this is specific for tonic-clonic seizure, drugs like lamotrigine, carbamazepine. Actually, all these drugs, like valproate also, all these drugs are used in patients, especially that has this tonic-clonic seizure actually. And also this lamotrigine, we have to really be careful that this lamotrigine actually can cause Steven Johnson syndrome as a side effect. So that is it. So this is the end of our lectures about epilepsy or epileptic seizure actually. So thank you very much.